Farm Talk on CFRU 93.3 FM. Welcome to another edition of Food Farm Talk, where we celebrate food and honor those who champion the cause of food in society.
Hello, and welcome to another exciting episode of Food Farm Talk here on CFRU 93.3 FM. I'm your host, Emily Duncan, and the show is also hosted by Abdul Rahim Abdullahi. As you know, we've been presenting webinars that have been put together by the Arrell Food Institute and the Food from Thought Initiative. The point of these webinars are gathering insight and sharing expertise that will ensure that our food system can overcome and adapt after the pandemic. So last time we aired the last one, which was COVID-19 Lessons for Food Systems. Today we'll be airing the first part of the next installment of the webinars, COVID-19 plus Data Decisions After Disruption. This will be focused on how we can use more data for decision making. This webinar is hosted by Jeff Wichtel, the Dean of the Ontario Veterinary College, and features expert guests Rozita Dara, Amy Greer, Simon Somogyi, and Alfons Weersink, all professors at the University of Guelph. We hope you enjoy this audio of the webinar. And we'll be airing part 2 of it next week. So thanks so much for listening.
Got data? That is the question of the day, it seems. There's a pretty good chance that you use data every day to inform decisions that you make for yourself or your family. It's also equally true that we use data to inform decisions for our whole populations, regions, countries, globally. In the midst of this pandemic, our interest in data has never been greater. Welcome to the panel discussion on data and decision-making during the time of disruption. It's hosted by the Arrell Food Institute at the University of Guelph. Let me first introduce myself. I'm Jeff Wichtel. I'm the Dean of the Imperial Veterinary College. And let me introduce our panelists today, our University of Guelph experts. Firstly, Dr. Rozita Dara. Rozita is Associate Professor, School of Computer Science. Dr. Amy Greer, Tier 2 Canada Research Chair in Population Disease Modeling and Associate Professor, Department of Population Medicine. Simon Somogyi, Arrell Chair in Business of Food and Associate Professor, School of Hospitality, Food and Tourism Management. And Alfons Weersink, Professor, Department of Food, Agriculture and Resource Economics. Let me start with you first, Amy. You're a mathematical modeler for infectious disease, especially much in demand these days. Let me ask you, how important have data been in our response to COVID-19, say compared to previous epidemics or other emergencies?
Yeah, so, we always like to be able to make decisions that are evidence-based. And I think the availability of data in the response to COVID-19 is really super critical. And certainly we've seen some changes since the 2009 pandemic of influenza. For example, a lot of the data sources that are available and that the public, as well as scientists, frequently check in on are publicly available. We have a lot of groups maintaining line lists of data, keeping track of case counts from different public health units across the country, and making really amazing data sharing resources publicly available. And I think that is something that's quite different, actually, than even in 2009. I think the other really interesting point related to data in the era of COVID-19 is the availability of preprints. As scientists, we engage in this research protocol where we conduct research and then we share our results by way of peer-reviewed publications. And the data on COVID-19, especially because it's an emerging disease, we're learning more and more about it every day. And preprints are kind of an interesting way in which the scientific community are sharing their results very rapidly as a way to get information out, sharing that information publicly with the scientific community, recognizing that those results have not been peer reviewed, but it still allows us to have evidence at our fingertips to be able to assess much more quickly than using more traditional scientific dissemination routes. So it's really quite an interesting scenario that we have not really seen in other public health emergencies.
Thanks, Amy. So a real democratization of data that's going on at the moment. So more specifically with the data that you work with every day, what's it telling us about where we are in this pandemic as a province and as a nation and globally? Are we in a recovery phase as we're often hearing in the news?
So I think the term recovery phase is a bit misleading, if you might. So, you know, what we know about this coronavirus is that it is highly transmissible, and that means it transmits from person to person quite easily. And most of the, all of the population is susceptible to becoming infected. We also know that it represents a number of extra challenges that we haven't seen with some of the other previously pandemic pathogens like influenza. With coronavirus, we know that transmission can happen before individuals are very obviously ill. And that makes things like contact tracing challenging, because if people are spreading illness before they even know that they're sick, it's very challenging to control an infectious disease that has that sort of biology. So in terms of where we are, what I'll say is that nationally, we use a term called the R0, or the basic reproductive number, to kind of assess disease transmission in a population. We know that that value has been dropping, and that's really good news. What that means is that as a society, we've been engaging in aggressive and early physical distancing to drive contact rates down. And that reduction in contact rate is really starting to demonstrate that we have been effective at slowing transmission. So early in the outbreak nationally, we were seeing a doubling of cases every 3 to 4 days. Now it's more like every 16 days. So that's really good news. The challenge is that we are not out of the woods yet. In the absence of a vaccine, as soon as we start releasing those physical distancing measures, we know that transmission will begin to pick up again. And so we are going to be in a position where we need to very critically use data to help us assess when we need to re-implement different types of public health measures in order to keep transmission low until we have a vaccine.
Thanks very much, Amy. Rozita, I'll turn to you now. You're an expert in the use of technology in the agri-food sector and society more generally. Can I ask you, are there specific examples of technology we are using or should be using right now to support an agri-food sector that's clearly under a lot of pressure?
So thank you very much, Jeff. I believe this pandemic will spark agility in digital agriculture, as it has re-emphasized the need to get access to some of the technology that exists in other sectors, and they are not easily accessible in agri-food systems. So this technology span from kind of simple requirements such as access to machine-readable data, which is not that much of an extraordinary technology, but not all sectors in agri-food or small-scale farms or businesses have access to such technologies. Also, it emphasizes the need for platforms that can manage data, and also more need for automation to be used for throughout the food supply chain. So these technologies, so what I expect to see that post-COVID will be a world with a lot more digital technology in agri-food system for food production, distribution, safety, traceability. So some of the simple examples are, for example, physical distancing requirement. We require, again, access to software tools that can collect data automatically rather than using paper-based processes. We will see increase in use of robots, drones, and machine learning, and cutting-edge sensors to collect data and make decisions based on them. So in China, the use of drone technologies in farm has skyrocketed just because they want to make decision, maybe increase crop area without having enough labor. Even I mean, despite having challenges in having labor, access to labor. Other technologies that I would see that there will be increase are e-commerce tools, because small scale farmers now are showing resilience to sell and provide food to the community, and they have turned into social media outlets and they are selling their product that way. But I have to also mention that these technologies, many of them are in the pilot stage, meaning that they haven't been widely deployed or tested. So one of the changes that I will see, culture changes that hopefully I will see in digital agriculture world, is deploying these technologies in the real world environment to test them at a large scale, and also engage the end user who are making those tools and will be making decisions with those tools. So that's one of the changes that I expect to see in the culture and how we are using and developing these tools. The other change that I expect to see is kind of having platform approach to digital agriculture. As you can imagine, our digital world has become decentralized these days, and we need connected platform. That doesn't mean a centralized platform, but connected platform with standardization on data and software and system that we can integrate such systems. We need a pipeline for safe data management, sharing, and security. We need better way to identify people digitally. This is a technology that is missing in almost all sectors, because without identifying in a secure way identity of a farmer or or somebody who is in the food supply chain, we cannot provide them service. So there are, I would expect there will be need for new platforms, legislation, and to enable this whole digital ecosystem to work efficiently and properly. But in terms of specific examples, again, as I mentioned, the use of automation tools, robotics in farms, and throughout the supply chain, there would be inevitable. I mean, there will be more of those tools. Another example, even for using contact tracing tools, even for agri-food workers, because as you know, one of the biggest outbreaks in Canada occurred in a meat processing plant, and we can use those tools to make the workers safe and also make sure that they comply with social distancing. So opportunities are enormous. There are lots that can be done with technology for future outbreaks, but we have to start working now, and we have to start to build that ecosystem.
Thanks, Rozita. That sounds like an exciting future. But the uptake of technology such as this, especially technology that involves tracing and sensing of individuals, it's sort of been unevenly taken up internationally. Some countries perhaps have embraced it before we have. Are there some real obstacles there in terms of privacy and the ethical use of data that we need to overcome as a country before we use some of these technologies?
For contact tracing, obviously, because we will be tracing individual and their most sensitive information, such as location and their identity, obviously it's quite sensitive data. Many countries, they have, for example, for South Korea, they have deployed such system, and there were lots of controversies around it because apparently that data was public for people to be aware, where some individuals visited, and although their name wasn't published, they became identifiable. But there are better, basically privacy has evolved. There are many best practices that are out there, such as privacy by design and other practices that if such tools are going to be implemented and deployed, they can take, practitioners, they can use to embed those the principles in the system and into processes and in terms of how they use that data. and to ensure privacy. So there has been some success stories. Apple and I believe Google, they're working with different governments. They are working with EU, they are working with the US government in terms of building a tool that doesn't collect highly sensitive data, but at the same time enables traceability, tracing infected individuals, and also so they are, again, they're not using, they're not collecting highly sensitive data. So there are solutions out there, how we can. So one thing we have to consider about these technologies is that they cannot be kind of, we cannot expect that to leapfrog them into the workflow. We have to integrate them into the workflow. And so this is something that I think requires a kind of multidisciplinary effort that for policymakers, technology experts, epidemiologists, healthcare providers, we all need to sit together and look at not only privacy, because privacy seems to me is very simple, one component of this entire kind of ethical aspect of using such tools. And privacy is a little tiny thing, which is very important, but it's not the only thing. I think it's important for all of us to sit together and decide about other harmful use of this data and make sure that we will avoid it, and kind of embed it into the workflow of the healthcare, basically.
Great, thanks, Rozita. It sounds like this emergency may well be the catalyst for getting everyone together to talk a little more deeply around this role of data and sensing and tracing. So thank you for that. Alfons, I'd like to turn to you now. Your area of expertise is agricultural economics, and I'd like you in particular to comment on how resilient our food systems have been under this current pressure that it's feeling. What do the data you work with tell us about how this pandemic has affected food systems, and particularly labor and workplaces that a number of our food processing facilities have been struck very heavily with this pandemic. Can you comment on any of that, please?
Yeah, first of all, Jeff, I'd just like to maybe just echo one point that Amy had brought up, and that's the scientific community response and the ability of data to respond very quickly, and how I think this pandemic has changed the nature in which we as scientists respond. A typical article has to go through a review process, and the economics profession has a terrible reputation for the length of time before an article is submitted, before it appears in print. But just to give a little plug to our profession, agricultural economics, the Canadian Journal of Agricultural Economics had a special issue on this, and it was put out in 3 weeks' time. The editors, Alan Kerr and from Guelph and Ryan Cardwell from Manitoba, got people together, said this is the deadline. It's not going to be traditional, but it went through a quick review process and very well received. And another, I think, outcome of that is the nature which we respond to these questions is through blogs and posts that are picked up. So as an aside, you talked about the resiliency. A number of us have commented on this through, I guess, non-traditional approaches that is due to the digitalization. So the food system and the resiliency of it has been bent but not broken, and I think that says a lot about our food system. What does initially, why did it bend is because the sudden change in the nature of the demand away from hospitality to the retail sector, and that meant that the whole system had to change in terms of the nature of the goods. We weren't selling little slices of butter or big tubs of butter to the hospitality sector. Now we were selling those 1 pound containers of butter, and so that nature of demand. In terms of what it might mean as we move forward, Jeff, I think that this trend of digitalization and automation is going to be enhanced because of this trend. Rozita's provided you a number of examples, but why is that going to occur? I think that farmers, for example, as we move through the supply chain from up to down, that farmers are going to be looking to ways to save on labor. They have for years. It's not a new trend, but I think this is just going to accelerate that movement to robotic milkers, to automatic picker of whatever crop or output it might be. So there's less reliance on labor. Moving forward, you've mentioned the processing sector, and that's the bottleneck in the system. There are, we've got all this farm product coming into a few major packers or processors, and then it funnels back out through the system, and that's the bottleneck. And if they have labor issues, in this case the health of the labor, then it shuts down, and we have implications that both at the farm level in terms of lower prices and potential shortages as we move forward. And then moving on, that I think that there is going to be issues at the retail, or the trends that we see at the retail level in terms of online purchase. I think we will continue to see afterwards. And in fact, I think things like moving away from going from the warehouse to the grocery store to the consumer, that we might just skip that grocery store. Why not go from the warehouse directly to the consumer? So all in all, I think that we've seen a system that has bent but not broken. It will continue to be challenged as we deal with the remaining period of this pandemic. But I think it's a tribute to the resiliency of it.
Well, thanks, Alfons. So it sounds like once this is all said and done, we won't really be back to where we were before, but there might be some significant systemic changes in the way food travels through society. Is that your feeling?
I think in a couple ways. I think that there might be a trend towards more local and more self-reliance, and so that's going to change the production system. There's going to be demands for that. Rozita mentioned some of the traceability technology. I think consumers are going to want to know more, not only how their food is produced, but where it's coming from, and likely support that demand for that attribute. And then as you move forward, there'll be more information on what consumers want, and the movement towards online purchase and delivery of food, I think will continue. And it will be interesting to see what happens to the hospitality sector after all of this. How will the services that they provide go back to normal? Will the extent of in-person service decline? Will we see things like ghost kitchens? That these restaurants have a kitchen that delivers, but they don't have any in-house. And data, the digitalization, the automation process will allow that process to happen.
Thank you. There's a lot to think about and unpack there.
So that's all the time that we have for this week. Tune in next week to hear these experts continue the discussion about COVID-19 plus data for decisions after disruption. Thank you again so much for listening to Food Farm Talk on CFRU Radio 93.3 FM. And join us next week at Thursdays at 10 a.m. Take care.
Thank you for listening to Food Farm Talk. See you next week for another exciting edition.